A scrub nurse is a registered nurse who assists in surgical procedures by setting up the theater before the operation, working with the surgeon during surgery, and preparing the patient for the move to the recovery room. My duties as a scrub nurse begin far before the start of the operation. I ensure the operating theater is clean and ready to be set up. Before surgery, we have a team brief with the surgeons, anesthetists, and other team members. To preserve the sterile environment, I scrub in, which requires washing my hands with special soap and donning on sterile gown and gloves. I prepare the instruments and equipment needed for the surgery and count all the sponges, instruments, needles, and other tools. The anesthetized patient is transferred to the operating table and the surgical safety checklist performed. The patient is then prepped and draped before knife to skin. During the operation, my primary duty is selecting and passing instruments to the surgeon. This requires to know which instruments are used for specific procedures and when they are needed, so I can quickly hand them to the surgeon. I must also watch for hand signals to know when the surgeon is ready for the next tool or when they are finished with a tool and ready to hand it back to me. Each tool is cleaned after use and placed back in its place on the table. After the operation, I count all the instruments, sponges, and other tools and inform the surgeon of the count. The tools and equipment are removed from the operating area. I then help apply dressings to the surgical site before taking the patient to the recovery area. I then complete any necessary documentation regarding the surgery. I then clean the theater and prepare the instruments for the next day. My name is Jethro, and I have been working as a scrub nurse at the RNOH for 4 years.